Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, a patient Sundar is admitted to the emergency with severe bradycardia following drug overdose. The concerned drug was taken for hypertension. Which of the following cannot be the drug? So if you see clonidine, propranolol, and reserpine can cause bradycardia, but hydralazine is actually a vasodilator. So it causes reflex sympathetic activity. There is reflex sympathetic activity will occur. Thus, it results in tachycardia, not the bradycardia. A pregnant patient Lata is admitted for workup for hemolytic anemia. She is given history of taking antihypertensive drug after the beginning of her pregnancy. The most likely drug is in the pregnancy, we can use methyl dopa is preferred in pregnancy. Shyam is admitted for emergency following a drug overdose with severe tachycardia. He has been receiving therapy for hypertension and angina. Which of the following can cause tachycardia? So, drug overdose of severe hypertension of tachycardia. So if you see guanethedin is alpha blocker. So as a result, it does not cause tachycardia. Okay, isosorbate dinitrate. Isosorbate dinitrate is a vasodilator which causes reflex activation of sympathetic system, thus causing tachycardia. Whereas propranolol and verapamil have negative inotropic effect, so thus they decrease the heart rate.
thank you and thank you for watching.